Hi, in this video, we'll try to talk about the prognosis of the treatment of HIV infection, that is human immunodeficiency virus infection treatment using homeopathy. This topic is less discussed because HIV infection requires to be treated using the conventional ART or antiretroviral therapy. So the treatment of HIV using homeopathy is always supportive treatment, because it is mandatory that the ART is given and homeopathy is given as a supportive, as additional therapy for the treatment of HIV. Estimated 0.7% of the world population, of course in certain parts of the world especially, that has known to be suffering with HIV infection. This infection is very severe, and this is one infection which one never gets rid of, as on the understanding that we have today. The patient never becomes virus free. So the treatment requires lifelong therapy. The ART is found to be effective, however, it is not enough in the experience of many HIV experts. This video is intended for the benefit of public, the general public, as well as for the homeopathic doctors, the students, as well as the HIV experts with different branches of medicine. We have limited experience using homeopathy in my personal space. We have found that we have treated around 200 cases of HIV, of course, as a supportive therapy in addition to the ART. And we have some observations based on that about the prognosis. I would strongly say that the prognosis using homeopathy as a supportive therapy gets better when homeopathy is used. How does it get better? We have also conducted some research trial earlier, observation study, which has demonstrated that homeopathic medicines, when given to the patients, they have a capacity to increase the CD4 count, and it has also demonstrated a possibility of reducing the virus or the viral load in the patients suffering with HIV infection. That shows that there is a great potential which needs to be explored subsequently. So in our limited experience, I would say that the medicines have shown efficacy to reduce the HIV virus, as well as to increase the CD4 count. Besides, it also helps to reduce the symptoms of the HIV infection in terms of chronic diarrhea, recurrent respiratory infections, weight loss, and some more. In general, the prognosis is described in this series of videos as either completely curable, symptomatic relief, partly curable, reducing the drug dependency, or not curable or incurable. In cases of HIV, I would like to say that homeopathy has a supportive role to play for the treatment of HIV. I would not recommend at this point that homeopathy should be used as a monotherapy or as the only treatment for HIV. I would not like to say that unless we have adequate studies which are not yet available. But I would definitely say that since HIV infection is not curable fully using the current conventional treatment, that is the ART, it means that the patients require additional therapy, and that in my view is homeopathy. Homeopathic treatment and the conventional treatment should go hand in hand in the treatment of the HIV infection, just like in many other infections and diseases. Of course, as I said already, it is recommended. I would strongly recommend homeopathic treatment to all the patients with HIV, right from the patients who are recently detected, as well as those patients who have severe infection, or even patients who have AIDS, whose CD4 count is less than 350. So all in all, homeopathy is strongly recommended as a supportive therapy for the treatment of HIV infection. I hope this helps. Thank you.